outside its doors and the Italian military moves in under the cover of darkness. Their first job, to find a place to bury the dead after Bergamo's cemetery near Milan was overwhelmed. In a rare late-night address, Pope Francis asked the faithful around the world to pray for Italy. Prayers which can't be answered soon enough. For CBS This Morning, Imtiaz Tayyab, London.
There is little social distancing in this quarantine center in southwest Pakistan. Hundreds of people are crammed in. Some are in small tents in an open courtyard. WhatsApp videos reveal filthy facilities and conditions so bad that people are protesting against the government keeping them there.
We don't need anything, neither food nor medicine, just let us go. We have money with us and we can pay our travel expenses.
The quarantine center is in Balochistan province near the Iranian border, where nearly 70% of the population live in poverty and many don't have access to basic healthcare. Government leaders say they are doing their best despite the limitations.
We are here to provide all the facilities. Obviously, there are resource constraints. This is a border town with few difficulties in facilities but we are trying our level best.
In case we get swamped by it, our health facilities will not be able to cope. And it's not just Pakistan, I would imagine the same in India, in the subcontinent, in African countries. If it spreads, we will all have problems with our health facilities. We just don't have that much capability. We just don't have the resources. Because of the effects of the economic slowdown, my worry is poverty and hunger. That worries me much more right now. For that, I think, the world community has to think of some sort of a debt write-off for countries like us, which are very vulnerable. At least that will help us in coping with it. I actually fear for what is happening in Iran too, because the sanctions already have impoverished Iran. On top of it, this virus. So that should be a classic example of a place where at least now sanctions should be lifted, because they are in a terrible state right now.
The symptoms, treatments, and timelines of having the disease vary depending on which category patients fall into. So let's break down what having COVID-19 looks like day to day for each level of severity. It can take as few as 2 or as many as 14 days after being exposed to the novel coronavirus for the first symptom to develop. This is when it might feel like a cold or the common flu. Many patients develop fevers early on. The World Health Organization China Joint Mission saw that about 88% of people who had COVID-19 had a fever. Another study out of China showed that while only 44% of patients had a fever on admission to a hospital, 89% eventually developed one. But there have been some cases that led with gastrointestinal symptoms. Diarrhea, nausea, vomiting, and/or abdominal discomfort may appear a couple of days before respiratory symptoms. This isn't the norm, though, because COVID-19 is a respiratory disease. That means for most patients, the virus will start and end with the lungs. In the early days of infection, the virus invades lung cells. Specifically, this can damage the cilia, the hair-like projections that move around to keep airways clear of mucus and debris. When cells get infected, they die and shed off.